the conference that anyone who works in emergency medicine as a clinician is able to come to and find things that will help them to update them on their day-to-day clinical knowledge. Hi, I'm Dr. Sue Dorrian. I work in Birmingham, so I work in Birmingham Heartlands Hospital and Good Hope Hospital clinically, and I'm the clinical lead for the Solihull Urgent Treatment Centre as well. I'm interested in medical education, so I also have some medical education roles at the Trust as well, and I'm the RCEM West Midlands Regional Chair. I was really pleased to hear that the conference was coming to the West Midlands, and the Birmingham Rep is a great venue to come to as well. So I was excited to hear that it was coming to the West Midlands to give us the opportunity to get some of our really good local speakers, some from our emergency departments, but many from our universities that partner us in training of medical students, as well as training of advanced care practitioners as well. We've got colleagues from Warwick University, colleagues from the University of Birmingham, and colleagues from the University of Aston as well, all of which have medical schools now and have advanced care practice training programs, who are joining us to share some of their research and some of their expertise, as well as some of their areas of interest as well, which I think is going to be a really strong program for us. We didn't want things that are going to be too niche or too specialist. What we were looking for was things that we see on a daily basis in the emergency department, but things where perhaps we have had new updates, where there's new evidence that's emerged, or there's been changes in treatment. So we've got some sessions around cardiology, looking at the chest pain guidance, collapse guidance, and changes in the management of paediatrics that have occurred. And we've got a session as well right at the end of the conference where we're looking at how things might have changed since perhaps some of us were at med school, around things that have changed in the management of diabetes and how that might present to the ED, things that have changed in the management of bloodborne viruses and how that might change how we manage things in the emergency department, as well as transfusion medicine and changes that are being made in the safety of transfusion for all of us working in the emergency department. So the idea really is that on every day of the conference, there's strong clinical sessions that will help people to get their clinical updates that they need. And there are also a few sessions focusing on the day-to-day things that make all of our work important and, make all of our work challenging at times as well. So things like the culture within the emergency department and workplace behaviours. The equality and diversity team are also hosting a session for us around equality and diversity and inclusion issues as well within our EDs. So alongside the clinical care, we've got a few sessions designed to just make us think about professionalism, attitudes as well at work, and how we can improve our own team working and our own contribution to emergency medicine. Professor John Warnell, who's from the University of Birmingham, who's a neurologist by background, who's going to be doing a session for us on clinical reasoning and diagnostic error, which is one of our fields in emergency medicine that often causes us difficulty and gets us into problems. So I'm really interested to hear what he's got to say about how we can avoid those problems. And then from a clinical point of view, I guess it's something that we see really often, but maybe there's more new updates than perhaps I'm keeping in touch with. So Prof. Gav Perkins, who's the Dean of the Medical School at Warwick University, is going to be talking to us about out-of-hospital cardiac arrest and research and newer evidence on how we should be managing out-of-hospital cardiac arrest.